And I will mute my audio.
Okay.
Thank you very much for doing this, Ken.
Hey, no worries. We're going to record it so that we can send it to others and they can see it too.
Terrific.
So Casey, I guess time to kick us off.
Good. I'm Reverend Mansfield Caseman, better known by Casey. I'm the Interfaith Community Liaison in the Office of Community Partnerships. And it's my pleasure to be introducing a session that is highly relevant for where faith communities are today. We can no longer be gathering even during this holy season. Everything needs to be done virtually. And many have been struggling to know what are the options and how can they be bringing people together for meetings, for worship, and for service. We have somebody with us now, the Reverend Dr. Ken Howard, who has worked in government and business and for over a couple of decades as an Episcopal priest. And he left that ministry in order to develop a larger one, helping faith communities prepare themselves for growth in the 21st century by using technology that he'll be describing today. And so I thank you, Ken, for being with us. Ken, by the way, has also served on the executive committee for the Faith Community Advisory Council, and so is very aware of where we are, interfaith, Anglican to Zoroastrian. And thank you, Ken, for being here to help us know how we can do a better job bringing our people together.
Okay. And Casey, would you start us off with a prayer?
O Lord of life and of love, we pause with grateful hearts. At a time like this, we can't help but to be grateful for another day. And our minds and hearts turn out at once to those who are suffering, whether that be physical or mental. Help us to know that we're not alone. And even while we cannot be physically together, this is an opportunity as we meet virtually to feel spiritually close. So be with us, inspire, and instruct us that we in turn can be of greater service with all those with whom you bind us in love and bid us to serve. Amen.
Thank you, Casey. So today we're gathering to talk about keeping congregations and their communities connected during the COVID crisis, both internally with themselves and externally with their communities. And this is really going to focus on strategies and tools, practical strategies and tools that you can use. We're going to be covering today is we're going to start with an introduction. That already happened, so we're well ahead. We're going to be talking about faith communities and worship during and after the COVID crisis. We're going to talk about using demographics to identify at-risk populations and analytics to identify vulnerable neighborhoods. Talk to you about a few resources that we can provide. And then we're going to unmute you all and we'll move to Q&A. So, some quick instructions. Just stay muted until the Q&A time. Well, I'll unmute you then. I've got my video pinned, so you can ignore the second one. You don't have to turn off yours. When the Q&A starts, set your display mode to gallery mode. That's to be up the upper right-hand side of your screen. That's so then you'll be able to see everybody. And then meanwhile, feel free to click on chat and record any questions that you want to put in the hat in there, and that'll get us a quick start when we move to the Q&A and discussion. So who am I? I am an ordained clergy for 27 years now. Time flies when you're having fun. I'm a ministry developer and redeveloper. That means that I have started congregations and I have restarted and turned around congregations. That's been my focus over all my ministry. I'm also a data-grounded consultant and coach. That means I bring a lot of this data to coaching relationships. I think of myself as a faith demographer and futurist. I've been studying the demography of faith as long as I've been a clergy person. And I've written on what the new paradigm, I've written about the fact that we're in a transition period to a new paradigm, and that is going to make some severe changes in the future, and even starting now, that I've written about. Former FCAC executive committee member. And I also think of myself as an ecclesiastical PETA. That stands for pain in the ass. Because when you do this kind of work, whether it's starting congregations or turning congregations around or helping people to cope with doing church in new times, doing their faith communities in a new paradigm, you have to be willing to be thought of as a pain in the ass. So anyway, so what is FaithX? As Casey mentioned, I started FaithX in 2016, and our primary focus is helping congregations and judicatories. That's the overarching organizations. They're denominational bodies. Help them survive and thrive in turbulent times by identifying, engaging emerging missional opportunities and challenges in their communities. Little did we know that when we said we would focus on turbulent times, that there'd be even more turbulent times coming. So, worship in the midst of COVID-19. So, there's a plethora of information about online worship, and I could spend the entire time and more just going into the details of how to do that. So, because there's so much out there, and because I'm actually going to be posting something on my blog in the next couple of days on my website that will have a lot of this information, I'm going to instead provide the larger context and give you a few do's and don'ts. And as I said, I will be posting more information about worshiping and fellowship and stewardship and everything that is involved in being a congregation in the time of COVID on our blog. So I'll give you that link at the end. So when we talk about worshiping during the COVID crisis, we have to recognize three things. First, that our old paradigms of being faith communities and congregations were one of the first casualties of the COVID-19 pandemic. First, it had us be extra careful, then it shut our congregations altogether, and now we're trying to figure out how to do worship and everything else all over again. So they're gone for good. I would argue that we're never going to be the same after this as before, and we're being changed right now. So they're gone, perhaps for good, and I mean that literally and figuratively, that we won't be the same, and we'll probably be better for it. God will use this to shape us and help us find the new paradigm of being congregations and faith communities. So the second is that a new paradigm of worship has not yet arisen from the ashes of the old. What God is going to be calling us to do is to be co-creators of the new paradigm, together with each other, together with our congregations, and together with God, which means that we're going to have to stop thinking about the what of worship, the what we've always done, and get back to clarifying the why we do this at all, and then start experimenting to find the new what's. And there may be many what's as we begin to develop this new paradigm. So there's going to be several things that we'll need to keep in mind, and I'll get to those in a second. Third, that clinging to our old paradigms of worship can literally be fatal. This is Angel Escamilla, who was the assistant pastor of Calvary Church in Naperville, and he was the first clergy casualty of COVID-19 in Illinois. Angel's lead pastor brought the whole worship team together to do worship, because in his sense of what the paradigm was of doing church, if you're going to do it online, you've got to live stream it from the church building. And not long after that, he was diagnosed positive, and within a few days, he was on a ventilator, and then he died. So 3 things are essential. Vision, having a clear vision of what God is calling you here to do, not the what, but the why you're here. Context, understanding what is new and changing that's going on around you. And then lastly, consequences, because every decision you make during this time is going to have consequences. And the consequences in this might not only be make you ineffective, but it can kill people. So here's a few do's about worship in the time of COVID-19, but also hospitality, fellowship, scripture study, just about every part of being church. So 1, buy your live streaming service through TechSoup. That's an online organization that provides discounted software and hardware to nonprofit organizations, including faith communities. If you have more than 1 service, get 2 rooms. It's cheap. You should do it, because if you have worship, what do people want to do after worship? They want to have fellowship with each other. They want to have coffee hour. And if you don't have a second Zoom room, we use Zoom. If you don't have a second Zoom room, they'll start talking right into the next service, having their fellowship time together, and then you won't be able to start the next service. So get 2. Think. You need to start thinking outside the box, and the box is the building. Start thinking outside that. Think about what's changed. Think about how your why is going to have to be changed to serve your people in this new context. Third, practice. I can't say enough about that. Before you ever turn on Zoom or whatever you're using the first time, practice. Hold a pilot test of what you're going to be doing. Set aside a whole hour, 2 hours even, if you're going to do that, so you can have your run-through service, and that you can spend some time afterwards to process it. And then instructions. When you have a new paradigm, you have to keep telling people what's new about it and what they have to do that's different from before. And so you need to put that in the emails you send out to people. That means you need to do that at the beginning of the service. That means if you have a Zoom room, a Zoom waiting room, most live streaming things have a waiting room. Put the instructions up in there. You can do that. So, and then mute. It's going to be terribly disruptive if everybody talks at once. And so you should only have everybody on when you want everybody talking. Otherwise, if you're doing a service from the beginning of from the front of the church, and somebody says something and they're not muted, it's going to draw the attention of the video to them, and actually shut off the audio of the clergy person or the worship leader. So then experiment. The only way we're going to figure this out is by trying, tweaking, discarding, trying again, getting feedback, and continue to iterate that until you've got it better. It's never going to be perfect, but it will get better. So be patient. You'll slowly figure it out. And then I already mentioned waiting room. And then the thing after that is move to smartphone giving. Because that's the only way, it's the only way that you're not going to lose a lot of revenue during this time. But also, and I'll get more into this in the next screen, is if you don't move to smartphone giving, you're putting people at risk. So don't live stream from the building. It's too dangerous. It sets a bad example. It says to them also that, well, clergy can defy the social distancing and gathering, but lay people can't, and that's not good. So we've all, in one way or another, in just about every denomination and every faith tradition, have said one version of, a faith community is not the building, it's the people. And it seems like we've been saying that forever, and it seems like now that we're in this time of COVID-19, God has kind of taken us by the hair and said, enough talk, start doing. And start thinking about the people, not the building. Do not tell your people to mail in their checks. Because if they've been mailing them before, you might be tempted to say, just keep it up, folks, but don't. If you have an elderly person that goes out to the post office or goes out to the mailbox in front, they may be touching something that somebody has already sneezed on or coughed on. So it may be infectious. And then at the other side, the people you're having count the money and tally it up and record it, they have to open mail that people have touched. And so it increases their likelihood of of becoming infected. And then just having them have to go to the church to count the money also puts them more at risk. So please don't. And do not password protect. This is a little controversial because there's been something lately, a new phenomenon called Zoom bombing, when people from the outside will get on and maybe say something inappropriate. Another person was saying that, we can't afford not to password protect our worship services because somebody might expose themselves, or some white supremacist or racist might get on and say something. But I can tell you one thing, in 27 years of ministry, I've seen people do every one of those things in the building. So, and it's much easier to mute people and kick them out of the Zoom session online. But if you password protect it, you're losing an opportunity. You're missing an opportunity to bring new people. You're shutting the community out. So let's move on into using demographics to identify at-risk populations. Now, full disclosure, for this segment of the webinar, I'm going to be using screenshots from an interactive online demographic platform and analysis tool that's available through FCAC, my organization. It's called MapDash for Faith Communities. And I'm also going to be using its 2-page online interactive analytic report, which is called a Neighborhood Missional Intelligence Report. You can find them here, bit.ly/faithx-COVID-19. And I don't want to be a salesperson on this, but I do want to let you know that for the duration of the COVID crisis, we've discounted all of our the cost of all of our resources by 10%, and we're applying for a grant from Lilly, and if that's approved, we'll be able to cut it even more. So this is what we call our Neighborhood Missional Intelligence Report. It has 2 pages. And the first page is all population characteristics, and the second page is all community characteristics. Now, I've taken the opportunity of marking it up so that you can see, when you open up one of these, that you'll see that it's that there are some areas here that are elevating risk. One is 65 years old plus, so that's a risk area. Also, in this particular community, this is actually around a church in our area, Ascension Episcopal Church in Gaithersburg. And the area right around their congregation has all this, like more than a third of their area around them is African American. A third is Latino, and about a quarter is African American. And minorities have a higher risk. Now, the second page is even more important. It has even more things that you can look at. All of these things that you see circled, there are risk factors for COVID-19. And in this particular case, I've outlined the ones that are doing okay and the ones that are standing out as being a risk factor now, an active risk factor. So taking a closer look. So households with no vehicles, that's a risk factor. The ability to buy food, if that's low, that's a risk factor. This is doing okay here. Poverty, it's doing okay here, but if people, there's a high level of poverty and a low socioeconomic status, then that's going to put people more at risk because they can't afford to do what would be necessary to prevent or mitigate. So people who don't speak Spanish or English, people who speak Spanish but English not very well, in this case, it's 9% of the population. So those people that fall into that group are going to be at risk. Unemployment is a risk. It's doing okay in that area. The percent that they're spending on mortgage income, if this is really high, that's going to be at risk. And here's one that really is at risk in this area, housing units, that 60% are renter occupied. And that could mean in the middle of this crisis, if they fall behind on their rent, they could be out on the street just like that. So that points to the possibility of homelessness. So again, I put red if they're elevated and green if they're not. And then you can see some more here at the bottom of this. Whether people normally have access to exercise, that's a predictor of health. And low access to exercise in normal times is a predictor of ill health. And if that's the case in normal times, they're likely to be less healthy when they enter this time of COVID-19 pandemic. So households with disabilities, households with a person with one or more persons with disability, they're at risk. And this is about maybe 30% higher than the national average. And people without medical insurance are at risk if they get COVID. So, and that's pretty high in this community. So then if we were doing this neighborhood missional intelligence report with the congregation, we take what we were learning, the kind of surface level stuff we were learning, and then we would dig deeper. So you can then actually look at workforce predominance, because service class and working class are more at risk than the creative class. So, and here you see some areas here, big areas that are heavy with service class people. Another area over here that's really heavy with working class employment. So this is really, really useful to determine where the people are who are at risk. Then you can begin to think of how can we creatively, without causing or becoming infected, how can we reach out to them? You look at racial predominance. We mentioned that African Americans and Latinos are more at risk than the rest of the population. And so this can tell you right where they are. So here's a Hispanic majority on both sides of the church. And there is a African American minority not far from the church. African American majority area, neighborhood, just across 270. This would be different from every congregation. And then we could actually click on these and find out things about it. Like this here is unemployment rate. Unemployed and underemployed are more at risk during any disaster, but now especially during the COVID-19 disaster. And so you can look and see here that there's right above the church, there's an area of large unemployment, 14%, like triple the national average. And then another one over here and another one over here. So there's quite a lot of at-risk people from the standpoint of unemployment rate. So there's more I could show you on that, but if you want me to show you this in the future of the actual thing, I'd be glad to do it. But in view of the amount of time that we have and trying to leave time for questions and answers, I'm going to move on to the next piece that we wanted to talk about, which is using analytics to identify vulnerable neighborhoods. Now, for this segment, I'm going to be using MapDash for COVID-19, which is actually a free version of MapDash that you can register to receive free through this link. So I really encourage you to take a look at that because it can be really helpful, as I will show you now. So these, when you get the MapDash for COVID-19, we built this with about a dozen or more, and we're adding every day, a dozen or more things that are useful to a congregation when they're dealing with the COVID crisis in their area. Everything from social vulnerability to nursing homes, location of nursing homes, pharmacies, healthcare providers, urgent care facilities, American Cross chapters, hospitals with beds and ICU, new COVID-19 cases, key retailers. Those are ones that would have food or medicine or that sort of thing. And then a Twitter feed for all the states and governors that you can actually find out what they're saying in real time. So probably the most important part of this, I would say, is this thing called the Social Vulnerability Index. This is developed by the CDC for any kind of infectious disease outbreak. And it has 4 indicators. And by social vulnerability, they mean 2 things, by the way. I'll get to the indicators in a second. Social vulnerability means that these people are both at risk for the virus, and they're going to be more impacted by it and have a harder time recovering from it. So those are the people who are going to need the most help during and after the crisis. So there are 4 indicators that are highly connected with, or highly correlated with social vulnerability to the COVID virus. Socioeconomic status, race and ethnicity, household with disabilities, and access to transportation for the reasons I've explained before. So here you see with the Church of the Ascension, the area right to above and to the right of their church is rated 80, 0.80. The highest is 1.0. So this is considered to be a very high socially vulnerable neighborhood. Down here, it's a little lighter. It's 73%, still high, but probably in the area of moderate to high. So still something to watch out for. The lighter it is here, the less vulnerability. And if you were using this, you could click on any one of these and find out what the vulnerability was. And you can scroll down and it can tell you what each of the individual indicators say down below here. So another thing that's an issue in terms of of vulnerability of neighborhoods is population density. The denser the population, the more at risk, the more vulnerable that neighborhood will be. This one is rated 94. I mean, the national average is 94. This is higher than that. These areas, these red areas over here, represent the highest risk areas based on population density. The highest risk neighborhoods, the highest vulnerability of neighborhoods. You can also look at where things are, the kind of the lay of the land as far as resources, COVID-related resources in your area. In this particular case, I'm not showing all of them, but here's a nursing home. So that's going to be high vulnerability. It says the bed counts, the residents, the excess beds, etc. Here's Holy Cross, Germantown Hospital. Tells you its beds, its ICU beds, its bed utilization rate. This is an annual rate, and so this is going to be worse. This tells you the normal availability that they have. So it speaks to the capacity of each hospital. And each of these little dots represent healthcare provider locations, and they're color-coded by their specialty. And then lastly, but not leastly, COVID cases by county. And this is updated daily. This one was last updated yesterday. 871 confirmed cases in Montgomery County, 21 deaths, no recoveries yet, too early for that. But you can see over here, the size of the dot indicates the number of confirmed cases, the amount of those, whether it's higher or lower. And I'll just, by way of comparison, show you New York County. 3,485 deaths as of yesterday, 72,000 plus confirmed cases, no recorded recoveries just yet. So before we go to Q&A, let me just give you a summary of what you can get free or discounted from us for dealing with the COVID crisis, COVID-related resources that we can provide. Free is MapDash for COVID-19. I encourage you to just go to the link that I provided, click on the, excuse me, click on the link that'll be there to register for this, and within a few days, you'll be given a dashboard for the MapDash for COVID-19 and be able to see all the things that I just showed you. The things that we actually do and provide and that we're now discounting, we can do a 45-minute tutorial for how to use MapDash for COVID-19. We can do what's called a neighborhood missional intelligence report, which I showed you before, that we can get that to you. We can do that with a 60-minute tutorial. And we can also do a neighborhood missional assessment, which actually we sit down with you and spend 4 hours walking you through identifying the opportunities and the challenges that are out there, in this case related to COVID-19, and what your opportunities for ministry might be, and then to help you look at prioritizing which of those opportunities and challenge God's calling you to engage. And again, don't want to be a salesperson here. You can use the link that I provided before to get the information about it, the costs and whatnot. So now it's time for Q&A and discussion. Let me unmute everybody.
Ken, thank you very much. You've obviously gone beyond just dealing with the current crisis to helping us think more creatively and constructively as to how, coming out of this, we're going to be able to rebuild our faith communities. Currently, people that have been asking me along these lines of their questions come back to a significant degree to resources for worship services. And I don't know if you're no longer, pastoring a congregation, but you may well know where to turn to for some of those. I know, for instance, the last one we put on our website was the Arts and Humanities Commission, because they have a lot of music and art that can be used, you see, as for images or for music during a service when you can no longer be calling on a choir, and not everybody has a music director that can be helping them at this time.
Mm-hmm. Well, this is kind of a work in progress. We're developing a resources page that people can refer to. In terms of things that you can use for worship, there's Zoom, but there's also GoToMeeting can work, Google Hangouts can work. You can live stream via Facebook Live. There's a number of things. If you go to the blog that we have on the blog post about worship, there's a lot of those listed there. The Episcopal Church Foundation is also working on creating a resource list, and I would recommend looking there. There's resources popping up all over the place, and we're just trying to capture them as we see them and just file them by title. And we'll be putting up a page probably tomorrow on our website that will have not only our COVID resources, but COVID resources in a lot of different areas.
Oh, thank you.
If there are specific questions about that, I can try and answer.
Mm-hmm.
People can feel free to unmute if you'd like and ask questions.
Another challenge is just, I guess, what equipment to be using. Zoom seems to be the most popular, though I'm also hearing the county now is going with Teams.
Yes, Microsoft Teams also. Microsoft also has Microsoft Classroom for doing your formation classes, Sunday school or the equivalent, with your kids and your adults, that you can actually use that for instruction. That's a good resource.
Mm-hmm. Another thing we're asking for, and we've posted a number of these now, would be to have faith leaders being videotaped. And this could also include, by the way, their homilies, prayers, music. But beyond that, we'd like them to be taping just what out of their sacred scriptures is especially relevant right now, and to offer maybe a 2 to 4 or 5 minute meditation, that sort of thing. Now, how can that be best done?
That I'm most used to using Zoom, and all you would have to do is turn it on, hit record, and start talking to it. You could do your homily right there, or a reflection right there, and then turn it off. It automatically saves and turns it into what's called a MP4, and then you can upload it onto your website. There's you as the clergy person may not know how to upload it onto your website, but there's some tech weenie in your congregation, probably a teenager or young adult, who knows how to do that, and you can start posting them there.
Right.
You can also, if you don't feel like you need to have video, there's a thing called SoundCloud, which doesn't cost a thing. You can get a free SoundCloud subscription, and you can just record and upload. You can, if you've got an iPhone, you can use the tool that's called voice memos. I use that all the time to record my sermons, and I still preach from time to time. So you can just record it there, send it to your computer, and upload it into to SoundCloud. I've actually got, if you want to see how that's done or how that's been done, you can check out my my sermon website, which is called Ramblings of a Reluctant Prophet.
Oh, that's a good title.
Or just look for Ken Howard, and you'll probably find it that way. So, and there are new resources, you know, coming out all the time. You have there's several ways that you can record on your computer, and here's the thing that I would say: people say, "Well, I don't know how to do it, or I don't know how to do it well, or it won't be of very good quality." And the thing is, people are hungry for connection. They don't have to have something that's taped in the church or live streamed for the church. They don't have to have high video quality. They have to have contact with you, and they have to have contact with each other. And they don't care if it's Hollywood quality. They care that you're going to the trouble to arrange it for them and to connect them one to another. So just try, just try. Any other questions? I would say, by way of winding things up, I've listed over here my email address, and so if anybody has any questions they want to ask me about this, they can email me at ken@faithx.net. If you'd want to book some time with me, like a half hour for some consultation, you can schedule me here at kenhoward.youcanbook.me. You can read our ongoing COVID blog series at faithx.net/blog, and the free resources that we identified that we have. You can get at bit.ly/faithx-COVID-19.
Thank you, Ken. This will be going up as well on our website, by the way. We're adding that very frequently. And one of 7 sections focuses on worship and spiritual practices. Mm-hmm. So thank you. We're stronger together. Look forward to more sessions of this kind.
All righty. Thank you very much, people. Thanks for coming, and call me if you need my help. Bye. And may God be with you. Casey, you want to stay? Oh, never mind.